Our understanding of genital and pelvic floor physiology is rapidly expanding. Humans and higher mammals have a natural, instinctive inclination to mount a strong sexual response after genital nerve afferent stimulation. Penile erection is controlled by spinal autonomic centers, the activity of which is dependent on input from supraspinal centers and genitalia. Pudendal nerve circuitry serves an essential purpose for sexual behavior, erectile function, penile rigidity, ejaculation, and micturition. The dorsal nerve of the penis is considered by sexual experts to be the single most important nerve in male sexual function and satisfaction. The cavernous nerve is very important, however, it is a conduit for brain-induced and reflexogenic neuronal instructions to reach the penis. This efferent pathway cannot function independently. Erectile dysfunction is the inability to develop and maintain an erection for satisfactory sexual intercourse or activity. ED is a highly prevalent medical condition often associated with multiple causes. More than 50 million Americans suffer from mild, moderate to severe erectile dysfunction. Existing solutions for erectile dysfunction, such as oral medications and injectables, are expensive and suboptimal in their reliability, requiring increased dosage and variable response. Men with difficulty in maintaining rigidity due to age-related or post-prostatectomy veno-occlusive dysfunction and neurogenic ED typically have a suboptimal response to current regimens for ED treatment. Current medications and vacuum-assisted devices have a high dropout rate and several local and systemic side effects and contraindications. From a neurophysiological viewpoint, scientists believe that penile erection is a culmination of multiple successful nerve reflexes that initiate a vascular event. Millions of nerve receptors line the surface of the penis and communicate with sexual centers in the brain and spinal cord. To safely and naturally stimulate these sensors, the urologists at Reflexonic created Viberect. The proprietary Viberect method mimics rapid and repetitive manual vaginal stimulation of the penis, which is a natural aspect of sexual behavior of humans and higher mammals. Simultaneous vibratory stimulation of both surfaces of the penis at high frequency for about 7 to 10 minutes can lead to reflexogenic activation of sexual pathways that initiate gradual filling of the penis with arterial blood by activating the nitric oxide synthase-mediated pudendal cavernosal reflex. Other physiological effects include progressive rhythmic contraction of the ischiocavernous and bulbospongiosus muscles via the bulbocavernosus reflex, which help in strengthening the rigidity of erection. This will prepare the user for successful sexual intercourse. Subsequent orgasm and ejaculation is greatly amplified. Viberect is the only proprietary device in the world that delivers targeted nerve stimulation to both surfaces of the penis, dorsal and ventral, using medical FDA-cleared soft pads which provide for a safer and more pleasant experience. The Viberect device has been designed and developed by applying more than 3 decades of basic science and clinical research on the role of genital afferents in the physiology of sexual response and pelvic floor function. Genital afferent stimulation using the Viberect device is a safe and natural modality that can be harnessed to amplify autonomic and somatic activity within the penis, spinal cord, and higher centers via established neurological principles. For more than a century, tens of millions of women have used vibratory devices on a regular basis for the purpose of sexual pleasure and orgasm. Vibratory stimulation is considered safe by the medical community with important benefits, such as orgasmic dysfunction, stress urinary incontinence, ejaculation, and erection. A recent large epidemiological study of the use of vibrators by American women and men has shown no complaints, and generally high satisfaction and improvement in sexual response. The Viberect device has been demonstrated to be safe and effective for provoking erections in men who suffer with mild to moderate ED and men who have suffered spinal cord injuries. Please speak with one of our representatives and discover the many possibilities of this scientific breakthrough to help your patients take command of their senses and greatly improve their quality of life.